Yeah. Santhya Kunjumon. Are you ready? Is your mic closed or what? Santhya Kunjumon. Yeah. Hello, Santhya Kunjumon. Unmute. Hello? Hello, Santhya. Hello?
Hello.
Yeah, what's wrong with you? Yeah. Come on, you can start. You can start.
Sir, hear me?
Tell me.
Good morning. I am Santhya, one of the registered nurses working in this department. How can I help you?
Yeah. Actually, nurse, I am in pain, but I'm embarrassed about the problem.
Okay.
Yeah.
So, yeah, try not to worry. You are in safe hands. Before the conversation, may I know your name, please, for better conversation?
My name is Abraham Lincoln, and I am 25 years old.
Okay. Abraham Lincoln. So you told that you are having the pain, and so how the pain is and where the pain is. Can you explain a little bit more about the pain?
Yeah, of course, nurse. I can explain. And, right. I am an apprentice, and, I feel though as I am weak because of this sickness, but I need painkillers more often than I take them.
Okay, Lincoln, I truly understand. I appreciate your concern, and you told that you are having the pain, and here the files also shows that you are having the pilonidal sinus. Am I right, Lincoln?
Yes, nurse, that is what is embarrassing me. I cannot tell too much about this.
Yeah. Would you please rate your pain on a scale that is 0 will be the least pain and
It
5 will be the
is
moderate?
something around 7, I can say, out of 10, nurse.
Oh, I truly sorry to hear that. There is nothing to overly concern about. Okay, we are here to help you, Lincoln. So, do you know about anything about the pilonidal sinus?
I don't know anything. I'm actually embarrassed because I did not pay attention to the doctor when he explained to me what a pilonidal sinus is. Can I still find out, nurse?
Yeah, sure.
Can you
Your
please
queries
explain me?
yeah, sure. Your queries are still valid and perfectly valid, and I will explain about the pyelonedysis. See, this is a small opening, a tract on the surface of the skin, predominantly, especially it is caused due to the ingrown hair, okay, and mainly the exacerbated by the sweat and the prolonged sitting. You already told that you are an apprentice and you are having the prolonged sitting job. Am I right, Lincoln?
Yeah, of course, nurse.
Yeah. So the pain also hurts a lot. Am I right?
Yeah.
Yeah. So can I examine your cyst?
Yeah, okay, nurse.
Oh, so during the examination, I can see it's inflamed. Okay, the swelling is there. So it's better to do the incision. So that means the removal, so that the pain will you will get the relax the feeling and comfortable also. How it sounds, Lincoln?
Yeah, okay, nurse. But the thing is, I want to tell you, I'm very clean, and due to my work, I shower in the morning and I have a bath at night. I can't say that this is I neglected it, nurse.
Yeah, I totally understand your concern, Lincoln. Try not to worry. See, I don't means it doesn't mean that you are unhygienic. Okay, it happens due to the prolonged sitting and the sweat also. Okay, it will hurt our skin. So due to that only this sinus happened. Okay, so it can be manageable and curable also. This a small incision we will do, and then after that the further care also you have to follow. Are you following me, Lincoln?
Yes, nurse, of course. And what do I need to do after the procedure, nurse?
Yeah, sure. See, after the procedure, this the you have to take the uh, means care. That means there can be chances after the post-operative stage. There can be chances of bleeding, and there can be chances of infection. I am not telling that the infection will occur, but there can be chances. That is the signs of infection. That means the fever can be there or redness can be there. If anything is there, you can approach me. And for that, for preventing the infection, we are providing the medication also. For the pain also, we are providing the analgesics also. And you have to apply the antiseptic dressings also. You have to follow. And you can come to my clinic. I will do the dressings also. Or I will teach you how the dressings are to do. Okay,
Okay,
Lincoln?
nurse. That's very nice.
Yeah.
I am ready to follow all the suggestions given by the doctor and all the recommendations provided by you. I will follow your advice. And when in the hospital, I will adhere to your regulations and rules, and then to the medication regimen also. I don't want to
Yeah.
suffer any more pain. So
Yeah.
I'll follow your suggestions seriously, nurse.
For the procedure, for the further procedure, I need your consent. Shall I get from you?
Yeah, thank you very much, nurse. I am ready. This is my concern. You want a written concern or an oral concern is enough?
Yeah, thank you, Lincoln. See, one more thing, you have to take care after the incision. That means the salt bath also you have to take. It will facilitate, help to heal the wound properly. Okay,
Yeah,
Lincoln.
yeah,
So,
that's
yeah.
very fine.
So far, I cleared all the doubts. Am I right, Lincoln?
Yeah, thank you very much, nurse. That's very
Yeah.
nice. Thank you once again.
Okay,
Yes.
Lincoln. Yeah,
So
thank you.
here we are with Santhya Kunjumon. Santhya Kunjumon. Okay.
Yes, sir.
Uh, right. I have only one granddaughter now. What to do? Mhm. Right. Now, Sandhya Kunjumon, you are doing fine.
Yes, sir.
So what you can do is you are speaking 7 to 8 sentences for each question. That's very good. That's a positive tone. But now, yeah, that's good. As of far as now, for the time being, it is correct. Now, what you have to do is among these 7 to 8 sentences,
Yes, sir.
okay, what are you have to identify now? Three things.
Yes, sir.
What are least important sentences? What are average sentences? What are extraordinary sentences? Now, okay, fun. We have to confine to our time now. We have to limit to our time now. So we have to come back to 5 minutes. So what you can do is, if you feel that
Yes, sir.
there are two very ordinary sentences, just remove them. Just remove them. Even without these sentences, it is okay. Such sentences you remove. Number one. Number two,
Yeah.
there are four average sentences. Those average sentences can be upgraded to extraordinary sentences. And the
Sure.
extraordinary sentences, let them be there like that. So enhancing quality, minimizing quantity. Minimizing quantity maximizing quality. So, unnecessary, redundant, irrelevant, meaningless sentences are there. Suppose, remove them. For example, you may say like this. There is no need to worry.
Yes, sir.
Is this really important? Is this really important? There is no need to worry. This is actually a wrong sentence.
Okay. Sir,
This is
instead
wrong
of,
information you are giving.
yeah.
There is a need to worry. That is why it is a problem. Na?
Yes, sir.
You have to take action plan for this. You cannot say there is no need to worry.
Okay.
Diabetes mellitus. Is there
Yeah.
no need to worry? There is need to worry. There is need to take action. There is need to implement a plan. There is need to be serious. There is need to be dedicated for your own health.
Yes, sir.
So you can, this is a nonsense sentence according to me. There is no need to worry is a meaningless gibberish. That's it. So how we can improve this one? Is there really no need to worry? Yes, there is need to worry. So you can tell like this. If medication compliance is ensured, then there is no need to worry. See the quality sentence now.
Yes, sir.
You're saying there is no need to worry. It is nonsense. How can you say there is no need to worry? There is need to worry. So instead of telling negatively, you're not telling you should worry. You're not telling you should not worry. Be diplomatic and say, if medication compliance is ensured, then there is no need to worry. That means if it is not compliant, you are not compliant with medication, there is some problem. You are indirectly warning him and directly comforting him. This is what is called quality enhancement. There are some students who don't attend these sessions. They think that somebody is speaking. Why should I be there? They don't know that they are learning from these sentences. Simon sir is giving quality sentences. See that girl. What is her name? Dr. Chabrani. She will be there. Even if it is a nurse speaking session, she will be there. Because she knows even 2 sentences Simon sir is telling. They are very important. Maybe I have to note them down. And this video is recorded. You can go to the YouTube and note down these points. Even I make my assistants to write down some sentences. So Jyotsna Chabrani, unmute.
Yes, sir.
You understand what importance,
Yeah,
what
yeah.
is the benefit?
Yeah, I can
This
understand.
sentence you cannot write on your own. You can visit YouTube and you can write this sentence. Even I don't remember what I told. That's it.
Yes,
So
sir.
that is what it is. Why this lady is sitting here? She's a doctor. She's not proud. She is down to earth. She is humble. Even there are some nurses who don't want to attend the doctor's sessions, but doctor sessions are even higher quality. Okay, so you can learn more from them. I think many of you have heard her session. Why I ask you people to attend doctor sessions also, because you'll get a lot of things from them. If you don't attend, then I have to teach all those things to you, so you can learn from them. Na? Passive learning. So what is the sentence I told? Let me recall. Yeah. Unless and until medication compliance is ensured, there is no need to worry. Now I changed my style. I changed my style. That was different and this is different. What was that sentence? If medication compliance is ensured, comma, then there is no need to worry. I know you cannot write it very fast. So afterwards, watch the YouTube and write there. Go to the ending and see where Simon Sir's face is coming. There you can note the sentences. only for the people who are non-compliant with insulin injections. Only the people who are non-compliant with insulin injections will face negative consequences. And therefore, compliance is recommended for maintaining or for managing the blood sugar levels. So this is another style of saying. And now I'm going to tell you another style. In case you are medication compliant, in case you are compliant with medication, then stop worrying. Taking necessary measures such as ensuring medication compliance will definitely assist you in managing your condition, managing your sugar levels, insulin, blood sugar levels. Once you follow the suggestions stringently, and take the medications as prescribed or recommended by the doctor, then you can stop worrying, because you can still manage your life as any other individual. The only difference is you are taking insulin injections. This is another style. Okay. So, Santhya, Kunjumon, what are quality sentences? Those you have to take. If you feel that they are unimportant sentences, just to throw them into the dustbin. No need to worry. Don't worry. Don't worry. But don't worry. I'm saying I'm worrying, you said don't worry. How can you say don't worry? I'm in pain. I'm in tension. How can you say don't worry? Give me the reason first why I should not worry. Then you tell me don't worry, I can understand. A number of patients who have been suffering with the diabetes mellitus for the past many years, they also felt a tension in the initial stages. But when they started implementing the doctor's recommendations, for instance, medication regimen, that is taking insulin injections on a regular basis and being compliant with them, and taking dietary regimen as prescribed diabetes diet, and in addition to that, following a regular exercise program, then trust me, you can stop worrying, because you are already managing your conditions very effectively. You can lead a normal life as any other individual. But the only difference is you are taking insulin injections and they are not. That's it. Rather than being non-compliant with medication and suffering with the sickness and problems and difficulties, being compliant and enjoying and leading the life as any other individual would be profoundly beneficial. I don't know what I spoke. I really don't know what I spoke. They come naturally. Now, if you ask me, sir, repeat, I want to write. I don't remember myself. Then I'll tell another style. I don't know. I don't even remember. You think, did I make a notes here? No. Then how can I remember and tell? There are many people say, sir, we wanted to speak too many things, sir, but when we started speaking, we did not get anything. Mine is reverse. I don't write anything. I just speak like that. I'm sorry to say, but when you ask me to remember, I will not remember anything. This is reverse story. Okay, that's what it is. So go to the YouTube, Jyotsna Chabrani. This session, see many sentences I have told. Write them down and inject into your blood those particular sentences, because quality breeds contempt. People will look at you, they'll feel jealous of you, they'll look with awe, they'll open their mouth and they should be shocked when you start speaking like this. Yeah, so that is how we are going to practice.